Hello, my name is Bryson and I'm doing my video presentation on the Community Rehabilitation Clinic, or the CRC, which is a physical therapy clinic that is giving physical therapy aid as a pro bono to populations who do not have health insurance here in the Southern Provo area. Um, the clinic itself is sponsored by the Rocky Mountain University, and their licensed and skilled professionals come in, most of them volunteer their time and abilities to be able to serve this population. And most of the patients that I was able to see while I was volunteering there were from the Mexican American population. Most of them just spoke Spanish. And I was able to volunteer as either a interpreter or an aide as well. The CRC, while it helps with any physical therapy related issues, they specialize in chronic pain rehab, neurological, orthopedic therapy, pelvic floor therapy, post-surgical operations, physical therapy, along with post-COVID rehab. Now, the idea of the CRC clinic isn't just to give back to the patients who are coming in, but also to help the volunteers give back to their community, but also understand cultural competency. So we were able to learn that that cultural competency in class is an ongoing process in which the healthcare provider strives to achieve the ability to work effectively within the cultural context of the client, so the individual, family, or community. So while that isn't the purpose of the CRC, it definitely helps the volunteers to understand and improve on their cultural competency, as it's an ongoing process and we strive to achieve the ability to work more efficiently or effectively. So it gives us volunteers the opportunity to increase that competency. Now, while I was working as a interpreter, I had the opportunity to work with a bunch of different patients who struggled to understand our physical therapy professionals who knew what they were doing, but most of them weren't very rehearsed in the Spanish language. And as we were learning about interpreter skills in this class, in one of the OYO lessons that we talked about six main important pieces of explaining the purpose of what you're doing while in the situation as an interpreter, positioning the doctor, the patient, and the interpreter all in specific spots so that the interpreter or that the patient feels most comfortable, keeping your phrases short as you're translating and interpreting, understanding the cultural context of from where the provider along with the patient are coming from, using first person language always, and maintaining eye contact with the patient at all times. I was able to learn kind of the importance of that, and that really struck me as we were learning those in this class. And that's the Community Rehabilitation Clinic, and that's my experiences that I was able to have with them.